When you move to that next step, mid-level, I'll call it, there are some of the key things around the interpersonal competency would include remembering that your scope is 360 degrees. All relationships are important.
Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm Jimmie Markham, Communications Manager for the Jindal School. I'll be filling in as host occasionally while Dr. Britt Barrett is off campus during the summer break. All right, I'm joined today by Mark Madden with Cejka Executive Search. And tell me, what is your title at Cejka, Mark?
I'm Executive Vice President, Managing Principal at Cejka Executive Search.
We are here to talk about soft skills, really, I guess, Mark. Is that right?
Yes, and it's one of those things that's important.
So let's go ahead and set the stage, and let's talk about why it is so important nowadays for healthcare leaders to display those leadership soft skills.
Well, as we have seen the healthcare industry really evolve over the past 20 years, but really at a much more rapid rate over the past 5 to 10, there are certain competencies that leaders are going to have, but healthcare is now being exposed to a part of the business that they had not been exposed to in the past. And what I mean by that is, as we're seeing reimbursement being ratcheted down, and we're also seeing that the relationship between hospital administration, physicians are becoming so much more important as they are expected to now be in a position to provide and looking at value over volume, as they are looking at concentrating on population health and the community's health in general. We are now looking at competencies and soft skills like collaboration, as an example. You went back about 10 years ago. You had separate entities. You had the hospital entity, you had the physician entities, and they would basically provide services for each other. But there was not a real driving force for them to be partners in delivering the care. Now, as those requirements are being pushed through the industry and maximizing the care for the dollars that are being allocated for it, they really have to collaborate more so and look at partnering through that delivery of care. So the soft skill of being able to collaborate is very important. Another key competency that we see as important in today's healthcare market is innovation. And that can be anything from using or looking for advancements in technology, telemedicine that will give you the opportunity to provide services in your hospital that maybe you weren't able to provide before, to being innovative in partnering, and again, using the word collaboration, with other healthcare providers. I run across every once in a while now, probably more so in some of the rural areas, where they are creating partnerships that they're going to buy an expensive piece of equipment, that they're going to share the cost. And looking at, is there any reason why when we're 30 miles apart, that we should both be spending that kind of money on a piece of equipment that we can share? So innovation becomes an important part of that. Innovation in how to provide services in a different way. How are we able to really focus and switch from in-bed, inpatient to outpatient to ambulatory and be innovative? And two other key competencies that are really important, and again, these have really come to the top fairly quickly, and that's the ability to be agile and adaptable. We are putting our business leaders in positions right now that they have to make decisions fairly quickly. We've got more technology. We have more data. Sometimes we don't know how to harness all that data to make decisions as quickly as we need to. But as they look at the strategies that they have in place, in a lot of cases, they will have to make decisions that they'll put them in a position of making that decision without 100% of the data or information. So as they start down a path, are they able to recognize quickly that they need to adapt? Do they need to be agile to move in a different direction, to stop, go back, restart, go in a different direction? Because you don't have the luxury of having a lot of revenue coming in to say, well, if we make a mistake, so what? We've got a lot of revenue there that we can try it again. No, you've got to adapt and be agile. So if I were going to put 4 new competencies at the top of the list for new healthcare leaders, it would be collaboration. It's going to be innovation. It's going to be being agile and also adaptable.
Yeah, that makes perfect sense. And getting to the innovation part of it, we recently had some guests on the podcast that one was focused on the telemedicine space. The other had a healthcare robot that would talk to patients remotely, and it is also a kind of a way to do medicine remotely. And with the Internet of Things taking over, physicians and healthcare administrators are having to deal with these new concepts that have to do with this totally new way of looking at the entire world. What kind of skills, in addition to innovation, would they require to have to go through to even be able to grasp it, much less pass that forward to their patients and fellow administrators?
And that's a really good question, because as we look at the advancement of technology, those of us that have been around in the industry a long time, we are seeing advancements in technology, not necessarily on the patient care side, but on the business side, that are becoming wonderful tools, but we don't always understand it. I remember 15 years ago when the chief information officer position really became an important part of the C-suite, and I would talk to CEOs and they say, oh, I need a CIO. And my question would be, tell me what you want this CIO to accomplish. And so many times I would hear, I don't really know what they do. I just need to have one, because we need to take technology and use that data that we have. And I see that in today's market as well, that as a leader, looking at it from an innovative standpoint, you have to be open-minded to listen to possibilities. And use the experts around you, and those that have grown up. And I'm going to be focusing on the younger generations of leaders that are coming in that have grown up with technology, and it is part of their life. It's not something that we have to learn. I have to do this. They like it. They know how to use it, and they will look to technology as a source of problem solving or providing a service that others may not think of. So from an innovative standpoint, be open and look at what are the possibilities that we can provide. I worked with a client not too long ago that has really pushed the envelope in that area, and with a serving 17 different states through their telemedicine program, and providing services to some of the rural areas that never would have been able to have those services and have access because of technology and being comfortable using that technology. So it's keep your mind open and reach out to those that you have on your team. And it may not be your immediate direct reports. It may be those that are at those mid-level management positions that are really comfortable with technology and look at it as a way to solve problems.
Yeah, that makes perfect sense. I'm thinking about all of these skills that a healthcare leader needs to have these days. And we are at the University of Texas at Dallas at the Naveen Jindal School of Management training students to become healthcare administrators. And it can probably become a bit overwhelming for some of them, thinking, well, gosh, I have to hit the ground running with all of these skills. But you and I have talked about this, and I guess you see it kind of as building blocks. As the higher you get, you obtain these building blocks of soft skills, and you're not necessarily going to have that entire bag of tricks at your disposal from day one. What advice would you give students to start building these and not be too concerned about having them all at once from day one?
I agree that as you look at where you see your career going as a leader, this is no different than any skill that you're trying to learn. And I'll use this if you've never been a long distance runner, but you have this goal of I want to finish a marathon. You don't just go out and run the marathon. You have to build up with it. You have to build your endurance, your strength, and you have a plan and you work through it. And you steadily build that endurance to the point that you can run the marathon. And I see this same thing in leadership. So let's look at a very important core competency for all leaders. And this has gone on for years. It's not just new. But when you look at the interpersonal competency, and this has become also important because this is where I see the collaboration part of it falling in, the ability to communicate and influence, and that comes under interpersonal. So if we would look at 3 different levels of leadership. So if you are just entering into your first leadership role, what I'll call kind of a first supervisor role, and you look at that interpersonal competency, at this stage, the building blocks you need to have are be able to communicate clear tactical objectives, be able to give effective feedback and critique, reinforce successes, and focus on building and maintaining good relationships with bosses, with subordinates, but then also to be able to maintain the proper balance of detachment and involvement. Those are things that you have to gain experience at that entry level.
My conversation with Mark Madden will continue in a moment. But first, here's a message from our sponsor. This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare. Now let's get back to our conversation with Mark Madden.
When you move to that next step, mid-level, I'll call it, there are some of the key things around the interpersonal competency would include remembering that your scope is 360 degrees. All relationships are important. Build supportive lateral relationships. Develop a reputation as approachable and a source of information and help. And also to start, and this is where we start getting into the EQ side of it, is that you realize and notice your impact on others and develop and fine-tune your self-insights. So that's that next building block under that interpersonal competency. When you move to the executive level, you should have those building blocks in place that I just shared. But then you need to be able to look at developing your ability to harness what I call the power of symbolic behavior. People are always going to be watching you. So you learn how to show the behaviors, attitudes, and actions that give your team the right message. Also to be able to develop strong relationships outside your organization. A good network can help you gather intelligence that will affect the company, the organization, but also, as we have been talking about, that healthcare is changing so dynamically, some markets hit those changes sooner than others. If you look at some of the states that are more highly regulated than others, if you look at the California, the Minnesota, New York, some of those areas, and if you were in Kansas, Missouri, Oklahoma, Texas, those of us that are in kind of the mid part of the country, we may not be affected by those as quickly, but we are starting to be affected. Have a network that you can call somebody in Los Angeles, San Francisco, Minneapolis, New York, wherever it may be, and say, how did you approach this? What were the results? What would you do differently? So building those outside networks are going to be really important. The other key component at this level is to be able to develop good political intuitions and skills. When you get to the executive level, there are going to be politics in some cases that are playing behind the scenes, whether it's with board members, whether it's with physicians, whether it's community members, whether it's with state and national legislators. You need to be able to have those political intuitions and skills, because in a lot of cases today, I find that especially CEOs spend a lot of time in front of lawmakers as we see those things changing. So you need to be able to develop those things, and then working on your insights. And that's just develop and nurture good sources of feedback, advice, and counsel. And I'll share something here. I was working with a CEO a few years ago, and we were going through a leadership development succession planning process for his organization, a large multi-hospital organization. And I remember one of the things that he shared with everyone that was there that I thought was really insightful to young leaders coming up. And his statement was, you have to remember that the farther you go up in the organization, the fewer people you are going to have that will be truly honest with you. You need to be able to be open to and create that opportunity to have individuals that are going to be there and say, you know what, Mark, you delivered that message. It really didn't come off very well. You probably should have said this, this, and this. So that's important. So an executive has to be able to be open to that and also recognize that you are always learning, continuing to learn and develop your skills, but allow that a group, or even if it's a small handful of folks, to be honest with you. So those are, as I look at the interpersonal side, those are the building blocks that I would see from supervisor, mid-level to executive.
That's fascinating. Especially the political intuition part of it. I couldn't even imagine how does one go about collecting those kinds of building blocks?
Usually it comes by experience. And as we would probably all admit, and this isn't a secret for anyone, that, we usually learn more when we fail at something. What would I do differently? And I've got a saying on my desk, and I share with my team too, that sometimes you win and sometimes you learn. And where I have really encouraged leaders as we look at helping develop the next generation of leaders, and you're really looking at mentoring and coaching, allow them to be sitting in those, whether it's board meetings or groups that we are discussing maybe an initiative or a subject that can be fairly volatile. And you start to develop your gut feelings, and it's about, boy, something doesn't feel right here. And then you have the courage to ask the question, to say, wait a minute, something isn't lining up here. I'm getting a sense that we're not all on the same page, or I don't feel that we have really openly discussed everything, and I'm getting a sense that maybe some of you have a different opinion. Let's put it on the table now. To be able to have the courage to ask, that's one thing. But it's those times when you didn't recognize that there was a political undercurrent, and it kind of comes back to bite you down the road a little bit, and you learn from that, and you eventually, the old saying is, you trust your gut. And if you've had enough of those experiences, you got to bring it up as a topic. Why am I feeling this way? Share that I'm not feeling this way. Why is this? I don't feel, Mark, you are being really, truly open and honest with me. Why is that? Why am I feeling this way? Tell me. So that's how you have to have the courage to face it, bring it up if you're feeling it, talk about it. You're not going to be right all the time, but at least you're addressing it. But then also learn from those mistakes that you've made.
Yeah, that makes sense. This has been such an interesting conversation. Tell me more about Cejka Executive Search. If people are interested in finding out more about your company, where can they go?
Well, they can go to our website, give you a little background on and Cejka Executive Search. We are part of Cross Country Health, corporate office in Florida. Our corporate office is in St. Louis, and we have actually 3 divisions within our organization. We have a physician search division that recruits on the clinical side. And then we have a what we call contingent search. We do more at that entry level, even staff level and entry level leadership positions. And then we have the executive search division, which I am part of. And we do a large portion of our work with our clients in the physician leadership space, in the C-suite space, CEO, CFO, and have been in business for over 30 years. And I think one of the firms that, because Cejka actually started in the physician space, has really developed a strong knowledge and understanding as the evolution of physician leadership has changed over the last 20 years. And we've got a real strong space there. And it's been one of the important components that we've looked at in identifying leadership and leadership skills, and what's different about identifying and developing leadership skills as let's say a practicing physician that wants to move into the administrative role. You're at a little bit point in your career and a little bit different education. How do I identify if I've got leadership skills, and where are my strengths, where are the areas I have to improve? And that's different from someone who had made the decision early in their career, I want to go through the administrative track, and has been able to get that education foundation on not only the operations of healthcare, but the business of healthcare, and then also having mentors and coaches along the way and kind of build that expertise where a physician kind of enters at a higher level and there's a lot more expected. So that's an area that we've looked at very closely and have good expertise in, as well as focusing on these new leadership competencies for leaders in healthcare today.
Excellent. Well, it's pronounced Cejka, but it's spelled Cejka, and that's CejkaExecutiveSearch.com.
Correct.
Mark Madden, it's been a pleasure having you as a guest on the show today. Really appreciate it. Thank you very much.
I've enjoyed it. Thank you for the opportunity.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode notes, links, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. Also, we want to hear from you. If you would like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z, and let us know how we're doing. I'm Jimmie Markham, Communications Manager for the Jindal School and the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.